Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the channel. Today's video is in continuation of what we are talking about anatomy of nose, already uploaded, and description box you can check for the links. Today we will talk about the anatomy of the paranasal sinuses. So let's start today's discussion. You are requested to subscribe, like and share the channel so you are not going to miss any further videos. So anatomy of the paranasal sinuses, we know that there are four paranasal sinuses, rather four pairs of paranasal sinuses, which are named as frontal sinus, sphenoid sinus, ethmoid sinuses, and maxillary sinus. Actually, these are air-filled spaces in the bones of skull, and they are in direct communication with the nasal cavities through their ostia, four on each side, right and left, and they are divided into two groups, which are called as anterior group of paranasal sinuses and posterior group of paranasal sinuses. This anterior group of paranasal sinuses, which includes maxillary sinus, frontal sinus, anterior ethmoidal air cells, and if present, middle ethmoidal air cells. And all these sinuses, that is the anterior group of paranasal sinuses, this opens into the middle meatus of the lateral nasal wall of the nasal cavity. Posterior group consists of posterior ethmoidal sinus and sphenoid sinus. Posterior ethmoidal sinuses, they open in superior meatus, while the sphenoid sinus, it opens into sphenoethmoidal recess. Just to recap the ostia of these paranasal sinuses, from above below if we come, this is the cross section of the lateral nasal wall, and this is the attachment of the turbinate where this my pointer is moving. This is the inferior turbinate, which is attached to the whole length of the lateral nasal wall. Then this is the attachment of the middle turbinate, which is attached to the posterior 2/3 of the lateral nasal wall, and then is the superior turbinate, which is attached to the posterior 1/3 of the lateral nasal wall. Below and lateral to each turbinate is its corresponding meatus. So below the inferior turbinate, here is the inferior meatus. Below this middle turbinate, that is between middle turbinate and inferior turbinate, this is the area which is middle meatus. Then below the superior turbinate is the superior meatus, and above and behind the superior turbinate is this sphenoethmoidal recess, in which you can see in the picture also that this is the sphenoid sinus and this is opening into the sphenoethmoidal recess. So sphenoethmoidal recess is above and behind the superior turbinate, then is the superior turbinate, below that is the superior meatus, and in the superior meatus the posterior ethmoid air cells open. Then is the middle meatus. In the middle meatus is the osteomeatal complex, where the anterior group of paranasal sinuses consisting of frontal sinus, maxillary sinus, anterior ethmoid and middle ethmoidal air cells, if present, they open in the middle meatus, while in the inferior meatus at the anterior end there is the opening of the nasolacrimal duct. This is another cross section of the lateral nasal wall. So here this is the sphenoid sinus. So this is the inferior turbinate here, and this is the attachment of the middle turbinate, and this is the attachment of the inferior turbinate. And here you can see the posterior, these are the ethmoidal air cells. So these are the posterior ethmoidal air cells which are opening into the superior meatus, while the sphenoid sinus, it is opening into the sphenoethmoidal recess. Anterior and middle ethmoidal air cells along with frontal sinus and the maxillary sinus, they are opening into the middle meatus, while in the inferior meatus nasolacrimal duct opens. Now osteomeatal complex, this is very important as far as the functional endoscopic sinus surgery is concerned. The attachment of the middle turbinate, that is called as basal lamella, then there is a bony projection in the middle meatus which is along the interior and floor of the middle meatus, that is what we call as uncinate process. Then bulla ethmoidalus is the most consistent anterior ethmoidal air cells, and between these two runs slit-like pathway which we call as infundibulum, and the lower part of the infundibulum and most medial part of the infundibulum is called as hiatus semilunaris, in which all these interior group of paranasal sinuses, they open. So this is another cross section describing the same things a bit in detail. Ethmoid and maxillary sinuses, they are present at birth, while the frontal sinus appear later on, around 2 years of age, while the sphenoid sinus, they appear around the third year of age after birth. So maxillary and ethmoidal sinuses, they are present at birth. Maxillary sinuses, their first radiological evidence is there at 4 to 5 months after birth, while the ethmoid sinuses, their radiological appearance will be at 1 year of age, while sphenoid sinus at 3 years and frontal sinus around 2 years of age. Maxillary sinus, they attain their adult size in teenage when secondary dentition has been completed, while the ethmoid sinuses, they complete early, around 12 years of age. Sphenoid sinuses again in adult age, while the frontal sinuses, they are the last one to attain the adult size in late teenage. Paranasal sinuses, they develop and enlarge after birth. Ethmoid and sphenoid sinuses may not be of significant size until the age of 3 to 7 years. The frontal sinuses, as I just mentioned, are the last one to develop and may not be of significant size until adolescence. The pediatric paranasal sinuses appear to develop in the following order. First of all, ethmoid, followed by sphenoid, then maxillary, and then lastly is the frontal sinus. Those who put everything to do till tomorrow, then near the exam, this is the situation for them. So do it today, do it now. So maxillary sinus, out of all these paranasal sinuses, is the largest one. It is pyramidal in shape with its base towards the lateral nasal wall and apex is towards the zygomatic process. In adult size, its capacity is around 15 ml and it opens in the hiatus semilunaris. It is also called as antrum of high Moore. This is the first sinus to develop embryologically. Initial development of the sinus, it follows the number of morphogenic events in differentiation of the nasal cavity. It begins as evagination of the mucous membrane in the lateral wall of the middle meatus when a nasal epithelium invades the maxillary mesenchyme, and this growth of sinus takes place by pneumatization primarily during 10th week, and later on secondary pneumatization takes place around 5th month. The maxillary sinus, they have got spurts of growth according to the dentition. So when deciduous teeth, they are erupting around 0 to 3 years of age, there is maxillary sinus is developing, and then secondary dentition, but it starts around 7 to 12 years, and it is completed about 12 to 14 years. So there are different growth spurts. Postnatally, it grows at 2 mm vertically and 3 mm anteroposteriorly, and radiographically, it is a triangular area medial to the infratemporal fossa. And this is the uh, milestones of development of maxillary sinus, that is 0 to 3 years. This is the dimension, it is ovoid appearance. In 5th month is the pneumatization. In 20th month there is a posterior development. In 3rd year it is half the adult size of paranasal sinus. 3 to 4 years then there is increase in width with facial growth, and position is that second deciduous molars and crypts of the first premolar molars are there, and it is prone to infection around 3 to 4 years of age. Then in 7 to 9 years again the dimensions they change as the dentition, secondary dentition has started at that age. It assumes pyramidal shape around 9 to 12 years, and antral floor is at the same level with nasal floor at the age of 12 years. While in 12 to 15 years, the floor of the sinus, it is 5 to 12.5 millimeter below the nasal floor, so that it has increased in its dimensions, and it has attained almost the capacity of adult size, that is 15 to 20 ml. And the floor of an average adult maxillary sinus is in relation with the second premolar and first molar, and if it is larger size, even the second molar can also be there in a relationship. But in average adult size, maxillary sinus floor is in relation with second premolar and first molar. And in old age there is resorption of the ridges and thinning of the sinus walls and extension of the sinus till crest. So developmental anomalies can be agenesis, there will be no development of the maxillary sinus, or aplasia, or hypoplasia, or there can be supernumerary maxillary sinus. Its relationships, the roof, roof is in relation with orbital floor. Anterior wall is the facial surface of the maxilla. Posteriorly is the infratemporal and pterygopalatine fossae. Medial wall is formed by the middle and inferior meatuses in the lateral nasal wall. And floor is the alveolar and palatine process of the maxilla, 1 centimeter below the level of the floor of the nose. As you can see in the picture also, this is the floor of the nose, and this is the floor of the maxillary sinus, which is a bit below the line of that. There are different recesses in maxillary sinus, that is alveolar recess, zygomatic recess, palatal and frontal recess. And teeth in proximity, I just mentioned, in average adult, the, in relation are the second premolar and first molar. Even second molar, first premolar or canine in that descending order can also be in relationship according to the size of the maxillary sinus. The natural osteum, it is located in the posterior half of the hiatus amylionaris, which is present there in the infundibulum, and it is tunnel shaped, uh, not detected endoscopically usually. Unfavorable position for gravity dependent drainage, because it is above the towards the supromedial wall of the maxillary sinus, and the posterior edge continues with the lamina peperacea, which is important for surgical dissection. There can be accessory ostium. In addition to natural ostium, there can be 2 to 3 accessory osteums in almost 30 to 40% of the people. Bony dehiscence is covered by the mucosa, and we call it as anterior and posterior fontanelles according to the position of these accessory ostium. Mucus is transported from the nose and paranasal sinuses towards the nasopharynx, where it is ingested and presented to gastrointestinal tract, and it forms the basis of functional endoscopic sinus surgery. So flow of the mucus superiorly is against the gravity in case of maxillary sinus. This upward course along the walls of the entire cavity and then towards the natural ostium in supromedial wall. From there it is drained into the ethmoidal infundibulum, that is hiatus semilunaris to be precise, and from there the mucus is coursing towards the lateral wall and carried medially along the roof to reach the ostium, and then mucociliary flow from the anterior sinuses converge to osteomeatal complex and carried to the posteriorly to the nasopharynx and inferiorly to the eustachian tube orifice. Mucociliary flow is at 0.85 centimeter per minute when it is smooth. When it is in jerky or mucostasis is there, then it is 0.3 centimeter per minute. Sometimes the situation is very critical, but you have to control. Now, second largest paranasal sinus is the frontal sinus. It is situated between the outer and inner table of the frontal bone, and it is again pyramidal in shape, just like maxillary sinus, but here the apex is upward and base is formed by its floor. Its capacity is 5 to 10 ml. Now, frontal sinuses, they are rarely symmetrical. So, asymmetry is quite common by a thin bony septum between right and left frontal sinuses. As you can see in the diagram as well, that this sinus is so small and this one is the larger one, and there is a thin bony septa in between which is dividing them into right and left. So, asymmetry is quite normal in case of frontal sinuses and in case of sphenoid sinuses as well. Frontonasal duct, it opens into the middle meatus. So anterior wall is formed by the outer table and posterior wall is formed by the inner table of the frontal bone, which separates the sinus from the cranial cavity. Floor is formed by a thin bone which is separating the sinus from the orbit, and medial wall is the thin bony septa between the two frontal sinuses. Ethmoid sinuses, as you can see, it is just like a labyrinth. So different air cells, instead of being a single cavity like other paranasal sinuses, this is ethmoid labyrinth. Different ethmoid air cells are present there, which we divide them into usually three groups: anterior ethmoidal air cells, middle ethmoidal air cells, and posterior ethmoidal air cells. These are present there within the lateral masses of the ethmoid bone. Anterior and middle, usually they are 2 to 8 in number, variable in different person to person, and they drain into the middle meatus, into the osteomeatal complex. While the posterior ethmoidal air cells, they are usually 2 to 6 cells and they drain into the superior meatus. So posterior ethmoidal air cells, they drain into superior meatus. Roof is formed by the anterior cranial fossa lateral to the cribriform plate. Lateral wall is formed by the orbit, optic nerve, nasolacrimal duct, which is separated by a thin bone which is called as lamina papyracea. Inferiorly is the maxillary sinus, posteriorly is the sphenoid sinus, and medially is the superior and middle turbinates. Sphenoid sinuses, again asymmetry is quite common in case of sphenoid sinuses, just like frontal sinus. So these are the sphenoid sinuses. You can see they are unequally divided by again a thin bony septa. Laterally in relationship there is cavernous sinus, and in the cavernous sinus we know that the third, fourth, fifth and sixth cranial nerves are there along with the internal carotid artery as well. Superiorly is the pituitary gland and optic chiasma. Inferiorly, here is the nasopharynx and the median nerve, and posteriorly on the back of sphenoid sinus, it is in relation with brain stem and basilar artery. So you can see how many important structures are there in relation with sphenoid sinuses. With that, we come to end of anatomy of paranasal sinuses. You are requested to subscribe, like, and share the channel so that you are not going to miss further videos. And thanks for watching.